Thinking about what I wanted to talk about, I thought about Olivia Newton-John song from the 80s, Let's Get Physical. And when you say let's get physical, what's been found is that exercise is probably one of the most effective coping mechanisms that can be utilized in order to decrease the likelihood of mental health issues. There are a variety of mental health disorders. There's a variety of mental health symptoms. However, when thinking about exercise from a biological perspective ultimately starts to get your endorphins moving. It helps to reduce stressors. It also helps to increase your mood, gets your brain stimulated. And so therefore, exercise has been found to be more effective than not. And so I call it just what the doctor ordered. It is the prescription for mental health, outside of medication, outside of also therapy. So if I take a step back and I think about the lifestyle choices and how do I implement exercise, one of the things that I found when talking about research and looking into research when it comes to mental health issues is that we are individuals that are whole beings. And a part of us being whole is that there are different aspects of our lives that make up who we are. And so if we are looking to work on our whole self, as I like to call it, in order for me to work on my whole self, I have to work on my various individual selves. If I'm working on my individual selves, I have to understand what they are. Some of those include my physical self, my social self with my relationships, my intellectual self, my ability to be creative, my ability to engage in activities that enrich my thinking, my spirituality, my spiritual self, my avocational self, which includes leisures and hobbies, activities, my occupational self, my workplace. And so all of these different areas ultimately help me to become whole. And whole stands for wellness, happiness, optimism, life satisfaction, and experiences. And if I take that physical self piece out of that and I start to just focus on the physical self piece, I realize that exercise is a part of my physical self. To also include eating, which I think we're going to hear about in a few minutes with nutrition, to also include my medical health, as well as my sleeping habits. So exercise and mental health goes hand in hand when it comes to me being able to be whole and me being able to then be able to gather the skills, the tools, the knowledge that I can use and be able to implement into my life in order to make sure that those symptoms that I may be experiencing at points and times in my life, whether it be symptoms of depression, symptoms of anxiety, symptoms of trauma, triggers that I may be experiencing at home, at work, in my regular day's life, in my relationships, I can use exercise as my moment, as one of those things that I do in order to be able to release, to be able to, for lack of better words, work out those stressors in a more positive way. Now, a lot of times we think about, well, I can go and I can work out. Sometimes people do more than what they should, and so there has to be some level of balance. And I like to use this analogy of the spokes in the wheels. If I'm riding on a bike and one of my spokes go out, then my bike is not going to ride smoothly, correct? It's going to be a kind of little bumpy ride. And so that's kind of what exercise helps us to do with our mental health. It keeps our life in balance. Exercise doesn't mean that I have to go and I have to hit the gym 5 days a week, 7 days a week, and I have to be in there for an hour or have to be in there for 2 hours. It just simply means going for a walk, jogging. Sometimes just engaging in cardio exercises in my house, whether it's turning on YouTube and doing some exercises with YouTube, or turning on some music and just dancing around the house for a few minutes, just having my moment. Exercise entails way more than just being in a gym, pushing weights, working out, doing what is called more of anaerobic exercises, where we're focusing more on strength conditioning and our muscle building, but doing things as far as aerobic is concerned that helps to begin to get me breathing a lot more, get the oxygen flowing more in my body in order to kind of have that even keel. So how do I figure out what do I need to do? It's about doing what's best for you, being able to recognize that this is a way to cope. This is a way for you to be able to handle the stressors that you are experiencing in your life. Developing you a wellness plan. Figuring out when is a good time for you, and not thinking, okay, well, I got to do it today, because if I don't do it today, then everything is lost. Finding some friends that may want to work out. Start your little walking group, maybe once or twice a week. You can do it at work on your lunch break. You can do it actually sitting at the red light, kind of doing some stretches in your car. It's all about finding what works best for you and developing and implementing you a physical wellness plan that will allow you to be able to start to utilize exercise more in your life. I promise if you use exercise, I'm not going to promise, I take that back. I encourage if you use exercise, that you will start to see a difference in your mood. You will start to see a difference in your performance. You will rest a lot better, because it does help you with resting. It does help as far as a lot of things up in your mind, because it gives you that chance to kind of just clear your mind for some clarity as well. So I don't have my PowerPoint. Do I have any questions?
This is a real question. What did you say hold meant? Oh, I'm sorry.
Oh, we're going to do the questions during the discussion.
Oh, okay.
Yeah, so write your question down on the postcard. We'll do it on the index card, and we'll do it.
I have an index card.
Did you get a index card?
She gonna need